Hi everyone, welcome back to the channel. Today we're going to cover one of the key topics in pharmacology, indirect-acting cholinergic drugs, also known as cholinesterase inhibitors. These drugs don't directly activate the receptors themselves. Instead, they work by increasing the amount of acetylcholine that remains in the space between neurons, the synaptic cleft. So let's see how these drugs work, what types they come in, and which ones are the most important. Under normal conditions, when a nerve impulse reaches the end of a neuron, acetylcholine is released and binds to its receptors, the muscarinic and nicotinic receptors. When these receptors are activated, sodium ions enter the cell and potassium ions exit, which ultimately leads to depolarization or activation of the cell. But after acetylcholine has done its job, it needs to be broken down so the cell can return to its resting state. This is where an enzyme called acetylcholinesterase comes into play. It breaks acetylcholine into choline and acetate. As a result, the acetylcholine in the synaptic cleft is removed, the postsynaptic cell relaxes, and the choline and acetate are recycled to form new acetylcholine, creating a continuous cycle. Now, acetylcholinesterase inhibitors act by interfering with this very process. By blocking the enzyme, they indirectly enhance cholinergic transmission. In other words, when the enzyme is inhibited, it can no longer break down acetylcholine efficiently. This means more acetylcholine remains in the synapse, producing stronger and longer-lasting effects. Simply put, the more acetylcholine stays around, the more active the parasympathetic nervous system becomes. So we can expect effects like increased glandular secretions, pupil constriction, slower heart rate, muscle contraction, CNS stimulation, and overall enhancement of cholinergic functions. Of course, provided that they can cross the blood-brain barrier. Acetylcholinesterase inhibitors are divided into two main groups: reversible and irreversible inhibitors. The reversible inhibitors bind temporarily to the enzyme acetylcholinesterase, blocking its activity in a reversible way, and these are the ones that have therapeutic uses in medicine. The irreversible inhibitors, on the other hand, bind permanently to the enzyme. They're commonly found in toxins and insecticides, and their strong, long-lasting effects can lead to cholinergic crises. In this video, we'll focus only on the reversible inhibitors, since they're the ones that are clinically important and used for medical treatment. So next, we're going to talk about the drugs in this group that have the most significant clinical applications. We'll go through them in order: Neostigmine, Pyridostigmine, Rivastigmine, Edrophonium, Donepezil, and Rivastigmine. We'll see exactly what each of these drugs is used for and in which clinical situations they're applied. Along the way, we'll also use a few simple tips and memory tricks to help you remember their names more easily. So if you want to learn these drugs thoroughly and never forget them, stay with us until the end of the video. Neostigmine. This drug has a short duration of action and does not cross the blood-brain barrier. As a result, it has no effect on the central nervous system. Its main effects are on smooth and skeletal muscles, where it causes muscle contraction. By contracting the smooth muscles of the gastrointestinal and urinary tracts, neostigmine is used in the treatment of postoperative ileus, or urinary retention, that may occur after surgery. On the other hand, by acting on skeletal muscles, it also plays a key role in the treatment of Myasthenia Gravis, an autoimmune disease in which the body's immune system destroys the acetylcholine receptors at the neuromuscular junction. As a result, the released acetylcholine cannot effectively exert its action on the muscle. Neostigmine works by inhibiting acetylcholinesterase, preventing the breakdown of acetylcholine, and increasing its availability in the synaptic cleft. This helps improve muscle strength and reduce the muscle weakness caused by the disease. To make it easier to remember, think of the mnemonic. Neo equals new muscle, because neostigmine helps bring new strength to weak muscles. Pyridostigmine. Pyridostigmine works very similarly to neostigmine, but its duration of action is longer. However, it still cannot cross the blood-brain barrier. This drug is the drug of choice for the long-term management of chronic myasthenia gravis. Mnemonic, pi equals pretty long-acting, to remind you that pyridostigmine lasts longer than neostigmine. Edrophonium. Edrophonium has a very short and rapid duration of action. Its main clinical use is in the diagnosis of myasthenia gravis, known as the tensilon test. In this test, if muscle strength temporarily improves after administration of the drug, it suggests a myasthenic crisis, meaning the weakness is due to insufficient acetylcholine. However, if muscle weakness worsens after the injection, it may indicate a cholinergic crisis caused by excess acetylcholine, leading to overstimulation and subsequent fatigue of the muscle. Although edrophonium is rarely used in modern clinical practice, it remains important from an educational perspective. Mnemonic, E equals exam, because edrophonium is mainly used for diagnostic testing. Donepezil. Donepezil can cross the blood-brain barrier, allowing it to increase acetylcholine levels in the brain. This helps improve cognitive functions such as memory and attention, making it useful in the treatment of Alzheimer's disease. Mnemonic, Donepezil equals don't forget, easy to remember since it helps with memory. It is often grouped with Rivastigmine and galantamine as the Alzheimer's trio, drugs commonly used to manage Alzheimer's symptoms. So up to this point, we've seen that cholinesterase inhibitors, by blocking the enzyme that breaks down acetylcholine, lead to increased parasympathetic activity and enhanced muscular and cognitive functions. We use neostigmine and pyridostigmine for myasthenia gravis, rivastigmine for anticholinergic poisoning, edrophonium for clinical diagnosis, and donepezil, rivastigmine, and galantamine for Alzheimer's disease. And remember, more acetylcholine means more activity, but it should always be kept within the therapeutic range. If this video was helpful, make sure to give it a like, subscribe to the channel, and share it with your friends who are studying pharmacology. Thanks for watching. See you in the next video.